Good afternoon, everyone, and welcome to the Measuring Communities Report Launch event. My name is Dermot Wadsworth. I'm the director of the Military Family Research Institute and a distinguished professor of human development and family science at Purdue University. During today's presentation, you're invited to submit any questions you may have at any time by using the Q&A feature you see on your screen. To make sure everyone's time is respected and we do not go over an hour, our staff will be monitoring and answering questions throughout the event. If you are watching this recording after the event, you can email your questions to mfri@purdue.edu. Next slide, please. For those of you who don't know MFRI and its work, I wanted you to know about our strategic goals, which are listed on this slide. They guide everything that we do, and we are interested not only in generating important new knowledge, which is our research mission, of course, but also in supporting the military communities that support military families, the people who work in uniform and out, veteran families. We also want to help civilian communities grow their motivation to support military-connected people. We want to influence policies, programs, and practices by educating others about what the scientific literature has to say about the work that we do with military-connected people. And we want to sustain and promote vibrant learning. Today, of course, addresses many of those goals. Next slide, please. Some of you may know us through Measuring Communities, but you might also know us through other MFRI programs. And hopefully on this slide, you see some familiar things. And if anything interests you and you would like to learn more about it and how you can work with it or benefit from it or make it available to your communities, please let us know, and we're happy to help. You also can learn more about MFRI and stay up to date with our activities by following us on social media or subscribing to our mailing list. And those links are here, and I really encourage you to do that. Now in its 10th year, Measuring Communities was created to provide diverse and reliable data about military-connected families and communities in 10 domain topics. Together, these domains build a holistic view of military and veteran families in communities across the country. Measuring Communities also helps leaders form decisions to better support military-connected families in their areas. Too often, data are gathered and sit on hard drives or benefit only the work of one organization when they can do so much more. Giving powerful tools to organizations that already make an impact in the lives of military-connected people can help them expand their reach even further. Collectively, these organizations, those of you on the call, reach millions of veterans, service members, and their families across the United States and even around the world, and Measuring Communities helps them to do their jobs better. Data in the portal can be visualized through a snapshot, charts, maps, and reports. Next slide, please. As we begin looking at the contents of this year's report itself, we're very grateful to our subject matter experts. They played a tremendous part in reviewing the content of this year's report and provided guidance where it was needed. Their expertise has been invaluable, and we are very grateful. Over the next hour, you will hear from members of our MFRI team and from our collaborators. We'll cover key findings from the report. After that, we'll hear from two data champions. Then, at the end of this event, we'll share the full report with you. I realize there's something missing from my list, which is that we're going to hear some remarks from our great partners at NMFA about policy implications. So you'll get that as well. There will be a link and a QR code on the last slide of this presentation where you can access the report and you also will receive an email tomorrow. If you are interested in viewing data relevant to your own community or doing customized work yourself on the site, we will provide a member ID at the end of this presentation so that you can access data in the online data portal yourself. We'll talk about that more later in the presentation. I now would like to welcome Katie Walter to discuss key findings of the report. Katie is a senior community outreach specialist here at MFRI, where one of her primary responsibilities is to promote and help to manage the Measuring Communities data portal. She also conducts trainings for individuals and groups on how to effectively use the portal, and she's open to invitations from people on the call and other organizations to do that. Before joining MFRI in 2021, Katie worked for a major health system as a community health improvement coordinator. Welcome, Katie, and thank you.
Thank you, Shelley. In this portion of our presentation, I'll preview a few key takeaways, and at the end of this launch, you'll receive full access to our report to learn more. So let's get started. Demographics. Some subgroups of the service member population are shifting, and this shift may impact the veteran population. Between 2019 and 2024, over roughly a 5-year perspective, we're noticing a few trends. Number one, more women are part of the military. In 2019, about 390,000 service members identified as women. In 2024, this number grew by 6,000, even though our nation's total military population declined during this time. We also see this trend represented within the veteran population. Between 2019 and 2024, women veterans grew by about 61,000 women, despite, again, an overall decline in the total veteran population. Number two, our nation's military is becoming more diverse in terms of race and ethnicity. Between 2019 and 2024, we saw a growing percent of service members who are a part of a racial or ethnic minority group. In 2024 specifically, about 33% of active duty and 28% of selected reserve identified as part of a racial or ethnic minority group. The same patterns hold true in the veteran population. Between 2019 to 2024, about 868,000 more veterans identified as part of a racial or ethnic minority group, despite, again, an overall decline in the total veteran population. And number three, the percent of service members with spouses is also changing. Between 2019 and 2024, the percent of service members who have never been married rose. In 2024, about 48% of active duty and 51% of selected reserve had never been married. This growth may signal that now about half of service members may experience portions or all of their military career without a spouse, which may highlight a growing shift of veteran spouses or children who are not present for their veterans' military service. Community. One of the biggest explorations of data in this report was centered on rural communities. As you may know, a rural community can be defined in a number of ways. Historically, we've reported on rural communities by the definition of the USDA's Rural-Urban Continuum Codes, which are at the county level. However, because this data is at the county level, it doesn't necessarily account for within-county variations of rurality, like if a certain part of the county is more rural than other parts. We've also noticed that the VA often uses another definition, the Rural-Urban Commuting Area Scores, to define the number of veterans living in rural communities for their programs and services. This rural definition, called RUCA codes, are at the census tract level, which does account for variability within a county, but of course uses a slightly different definition for rurality. Using these RUCA codes, we're finding that approximately 4.3 million veterans lived in a rural community in 2024, which is a slight decrease from 2023 and something that we're definitely going to keep an eye on in future reports. We then investigated the socioeconomic state of veterans living in rural or urban communities using these RUCA codes to understand any financial-based challenges. We found that the community in which a veteran lives can influence the socioeconomic status of the veteran, and this differs by age. For example, a higher percentage of younger urban veterans aged 18 to 64 report an income below the poverty line than younger rural veterans. This trend is the opposite for older veterans, aged 65 and older, where a higher percentage of older rural veterans report an income below the poverty line. Regardless, though, of the community in which veterans live, the percentage of older veterans with an income below the poverty line is getting worse, while the percentage of veterans aged 18 to 64 with an income below the poverty line is getting better. These trend lines are also projected to intersect, which is what you can see on this slide here in the figure. This means that historically, we've known younger veterans to have an income below the poverty line at higher rates than older veterans. But soon, this pattern is projected to be the opposite, and in many ways, it's likely present now in year 2026. Military-connected children. Historically, in our K-12 education section, we've reported on children who are part of military families, such as children living in active duty families, National Guard families, and reserve families. However, for this report, we were able to mine data from the census that looks at the veteran household and children who have a veteran parent, something we've not done before. We know historically that about 20% of U.S. veteran households have children, but until recently have been a little limited about the demographics of the veteran parent and their child. We now know that in 2024, approximately 6.2 million children aged 0 to 18 live in a veteran household. Most, or 61%, have a veteran parent who is aged 35 to 54, and most, or 74%, are school-aged in elementary, middle, or high school between the ages of 6 and 18. Medical care. For the first time, we mine data from the census to identify service members and veterans by health insurance type. We found that about 10% of selected reserve service members, which includes the National Guard and Reserve, report no health insurance. This percentage has been a consistent trend for at least 5 years, since 2019 to 2024, and is higher than the veteran population and, of course, active duty, who are 100% covered by TRICARE. In our report, we theorized and investigated why this may be the case for selected reserve service members to be without health insurance. We imagine that this high percentage could be due to a few factors that make health insurance options or benefits like TRICARE or the VA ambiguous, complex, or costly. Also, there tends to be an underlying assumption that health insurance coverage is given to at least part-time civilian employment, which many National Guard and Reserve have, but this might not always be the case. Considering that access to health insurance and health care tends to be a protective factor for overall health and well-being, and of course included in conversations about mental health especially, this finding tends to not just be a bit alarming, but also may play a role in military readiness or retention. Our special section in this year's report is on veterans living in U.S. territories and tribal land. We decided to investigate this group of veterans through conversations we've had with folks like you, who are always eager to learn more about the data that's available for military-connected communities. This section really acts as a special section because it's a little different than other sections in the report. Really, this section offers the type of data that is available and accessible for these communities And that is the big takeaway, since historically it's been pretty difficult to find this data or mine this data from the census. For some highlights, in 2024, about 64,000 veterans lived in Puerto Rico, and about 50,000 veterans lived on tribal land in the U.S. For veterans living in Puerto Rico, about 19% of veterans aged 18 to 64 and 18% of veterans aged 65 and older report an income below the poverty line. These percentages are about 3 times national veteran averages, though this doesn't appear to be a uniquely veteran issue. It still gives us insight into the socioeconomic state of veterans living in Puerto Rico. Also, about 40% of veterans in Puerto Rico have a service-connected disability rating, which is higher than national veteran patterns as well, which hovers right around 30%. The veteran population living in Puerto Rico tends to be older than the total national veteran population, though this finding tends to signal that a high percentage are VA connected, which of course is a protective factor for overall health and well-being. For veterans living on tribal land, about 12% of veterans aged 18 to 64 and 10% of veterans aged 65 and older report an income below the poverty line. These percentages are not as high as the percentages for Puerto Rico, but are still higher than national veteran averages, which again may provide additional insight into the socioeconomic state of veterans living in tribal land. Also, about 26% of veterans living on tribal land have a service-connected disability rating, which is lower than national veteran patterns. This could signal that veterans living on tribal land may be less connected with the VA than other veteran groups and may suggest prioritizing this group from a VA lens or perspective. We hope that these key findings help to inform your work as you serve military-connected families across the nation. Much of this data that I've presented on today can be found in our Measuring Communities online data portal for your county, your congressional district, or your state, which again we'll touch on in just a bit. Remember to stick around until the very end to gain access to the full report to learn more about the key findings from other sections not mentioned today. Thank you so much, and back to you, Shelley.
Thank you so much, Katie. I really enjoy hearing you share insights, and for everyone on the call, this is of course nothing but appetizer. So please feel free to engage so you can get the large plate later. I'd like to welcome Eileen Huck, the Director of Government Relations at the National Military Family Association. In her role, she leads the development and execution of NMFA's legislative strategy. She also monitors issues that affect the quality of life of families in the uniformed services. We're especially excited as one of our speakers today, as NMFA and MFRI have built a strategic organizational partnership that allows us to exchange policy expertise from NMFA and research expertise from MFRI to increase both of our impacts in serving military-connected families. Today, joining us to discuss some policy implications from the housing-centered data shared in this year's report. Welcome, Eileen, and thank you.
Thank you so much for that introduction, Shelley, and thank you for this opportunity. Good afternoon, everyone. I'm thrilled to have this opportunity to discuss some of the policy implications of the report. I'm looking forward. I know you're all looking into it in greater detail. It has a lot of really important and essential information about military families. I'd like to start out by sharing just a little bit about my organization for those of you who may not be familiar with us. I am, as Shelley said, I am the Director of Government Relations with the National Military Family Association. Like most NMFA staffers, I myself am a military family member. My husband is a retired Navy officer, and my son is currently in the Navy. And as Shelley mentioned, I'm here to tell you a little bit, not just about my organization, but how our advocacy aligns with the issues identified in the Measuring Communities report. Next slide, please. So I always like to start these presentations. Oh, can we go? I'm sorry. I always like to start these presentations by telling the group a little bit about the origins of the National Military Family Association. NMFA was founded back in 1969 at the height of the Vietnam War by a group of military spouses who were worried about one of their friends who had recently been widowed and was left basically destitute, because at the time there were no very few supports for surviving family members. So this group of military spouses put on their hats and got their purses and went to Capitol Hill and advocated on behalf of their widowed friend, and their advocacy led to what is now known as the Survivor Benefit Plan. And that was just the first of what has been more than 50 years of legislative accomplishments on behalf of service members and military families. NMFA is unique among military service organizations in that we serve service members and families from all uniformed services, to include all ranks, branches, and components, along with retirees, survivors, and their families. And we shape our advocacy through our connections with military families, as well as our research and our partnership with organizations like MFRI to help inform us about what issues are important to families and to help shape our advocacy. Next slide, please. So what is our mission? My boss always likes me to remind everybody that our mission is to work with families to identify and solve the unique challenges of military life. And there are many ways we do this. We do this directly through our programs that support military families. We offer a scholarship program for military spouses that helps military spouses who want to complete their educations and re-enter the workforce with funding to help accomplish that. We also offer a camp program, Operation Purple Camp, for military-connected kids to give them the opportunity to have a week of summer camp away from the challenges of military life and connect with other people, other children who have similar experiences as part of military families. We also offer programs for teens to allow them to connect and share their experiences as military family members. So that's how we directly serve families. But the heart of our organization is really our advocacy. Our mission is to help solve the challenges of military life through our advocacy on Capitol Hill and with the Department of War. Next slide, please. So our core beliefs, these are the beliefs that shape our advocacy and our approach to serving military families. And I think they're all pretty straightforward. Our families serve too. Together we're stronger, that we are stronger when we come together as a community to advocate for each other and for enhancing our family's quality of life. We are a nonpartisan organization. We believe strongly that military families' well-being shouldn't be jeopardized or put at risk because of partisan politics. And, you know, military life can be challenging, and we believe strongly that military families deserve the access to the support and services that they need to thrive. Next slide, please. So why do we believe that advocacy is important? At its foundation, military family quality of life is a readiness issue. Service members can't be expected to do their important work defending the country if they're worried about the well-being of their family back at home. Looking ahead, today's military kids are tomorrow's service members. We know that military-connected kids and teens have a higher propensity to serve. So protecting their well-being and their quality of life now helps ensure a ready force, not just today, but in the future as well. And then, you know, foundationally, we know that military families make many sacrifices to serve, and we owe it to them to honor their sacrifice by ensuring they have access to the same resources and opportunities as their civilian friends and neighbors. Next slide, please. So we really advocate on the whole range of quality of life issues affecting military families. I often say if there's something that is affecting a military family, chances are we are working on it or have in the past. But our focus really has fallen into two related pillars. One is mental well-being and one is financial stability. And as I say, those two issues are very much related. We know that the unique challenges of military life, including trainings and deployments, frequent moves, repeated school transitions for military connected kids, can have an impact on military family mental health and well-being. But there are also unique challenges to military families' financial well-being that are related to the challenges of military life. For example, the frequent moves make it very difficult for military spouses to maintain careers, leading to chronic underemployment among military spouses. Childcare, that's kind of a catch-22. If you can't find high quality, affordable childcare, it's difficult as a military spouse to go to work. But if that childcare can be so expensive that you end up working just to pay for the childcare. Many people don't realize that military families face some of the same financial challenges as their civilian counterparts, such as educational debt and medical debt. And then there are costs that are unique to military life, such as costs associated with housing. And that's what I'll focus on in the next couple of slides. Next slide, please. The report will, as you'll see when you read the report identifies several challenges related to housing for military families, both in terms of affordability and in terms of quality. As I'm sure many of you know, the majority of military families live in housing in their local civilian communities, and they receive an allowance called the Basic Allowance for Housing to help offset the cost of housing. However, that Basic Allowance for Housing, or BAH, is not aligned with housing costs in many locations, so many families end up having to pay out of pocket, which is a financial pressure. We're advocating for legislation that would align the BAH with local housing costs. So instead of expecting military families to pay out of pocket for their housing, the BAH would fully cover the cost of housing in a given location. And we're also encouraging the Department of War to ensure that the BAH accurately reflects local housing costs and is sufficient to pay for the kind of housing that military families find appropriate in locations that are convenient to the base and offer amenities like good quality schooling. Next slide, please. So the other housing issue that is identified in the report relates to healthy housing, and this is specifically about housing on military installations. About 30% of military families reside in on-base military housing, which is owned and operated by privatized housing companies. And this was a solution for the military services so that they did not have to bear the cost of operating and maintaining houses on base. But what we have unfortunately found is that many of the houses on the installation suffer from a range of unsafe conditions and environmental hazards, and that families unfortunately often have limited recourse when they find themselves in those situations because the privatized housing companies have longstanding leases and don't report to the military command. There can be little incentive for them to respond in a timely manner when families report maintenance issues or environmental hazards. This Congress, we've been working on something called the MOLD Act, which focuses specifically on environmental hazards in privatized military housing, sets a universal standard for acceptable indoor humidity levels, increases accountability and transparency by mandating independent third-party inspections of units, and includes an enforcement mechanism to incentivize contractors to respond to complaints in a timely fashion. There's so much more in the report that I would love to talk about, but I want to leave time for our other presenters, so I will wrap this up. Next slide, please. But I encourage you to check out our website for information about all of our advocacy efforts, as well as our programs that serve military. And I look forward to the discussion at the end of the program. Thank you so much for the opportunity today.
Thank you so much, Eileen. I really appreciate you being with us today and for educating us about the policy implications of these issues and the activities that you're working on. I would now like to introduce the first of our two champions. We're so excited about this program and so grateful for their participation. Our Measuring Communities team developed data profiles of the communities the data champions serve. Profiles were created to support the work by our data champion partners to help them make data-informed decisions. Both champions will tell us how they worked with our team and how the data were used to support the military-connected families in their areas. We ask them to do this as a way of inspiring you and helping you think about ways that you can use data even more effectively in your organizations. We now welcome Nicola Winkle. She is the project director of the Arizona Coalition for Military Families, where she specializes in program development and implementation. She is the spouse of a veteran who served in the United States Marine Corps and Operation Desert Shield, Desert Storm during the first Gulf War. Welcome, Nicola.
And thank you for having me. It's great to be with you all today and share about our experience in partnering with MFRI as data champions. I was saying that we are sort of a textbook example of why this is so important, because I've known about measuring communities for many years. I have used it in the past, but not in our current work. And so it was a great opportunity to refresh myself, see the new things that are available, and to really remind me that we need to tap into this resource on a regular basis. So I hope this gives you some ideas as well. Thank you for having me, and you can go to the next slide. So I'm just going to talk briefly about our work in Arizona so you kind of know where we're coming from as we came into this Data Champion project. Next slide. So here in Arizona, we have the Arizona Coalition for Military Families. It's our public-private partnership and collective impact initiative. And we focus on helpers, organizations, and communities. And we were established in 2009. So this is really the entity that connects our military, government, and community organizations and partners to build that ecosystem of support. We also have Be Connected, which is our statewide upstream prevention program. We have about 500,000 service members, veterans, and their families across Arizona. And we're focusing on all the social determinants of health, which align very well with the Measuring Communities report. Be Connected was established in 2017. Next slide. So as you all know, when we're addressing these complex issues in our military and veteran community, we need dynamic solutions that are multifaceted. So we work across these 5 domains for Be Connected, and this is what makes up our ecosystem of support. So we have our people, which is of course our service members, veterans, and their families. We also focus on helpers, both informal and formal helpers, equipping them, connecting them with both public and private sector organizations. We work with communities statewide, and I'll talk a little bit more about that today. And then we also focus on the systems that connect and serve our military and veteran population and strengthening how that happens. So many of our initiatives and solutions will work across multiple domains, and this gives us the opportunity to, again, look at those complex problems and find solutions together. Next slide. And this combination of the coalition and Be Connected allows for working across and combining resources from multiple sectors. It allows us to approach these complex issues like suicide with multifaceted data-driven solutions, and really helps us expand our focus on suicide outside of crisis intervention, which is really essential. Next slide. So I'll talk a little bit about why we applied for Data Champion. Next slide. So for us, we wanted to add more pieces to our data puzzle. We're always interested in when we can learn more, we can better understand what's happening in our community. And the timing just coincided with the relaunch of our Be Connected Communities initiative. This is actually something we started in the fall of 2019. It was going really well. And as you can imagine, when March of 2020 hit, it really kind of put the brakes on everything. So we're circling back around with this and really focusing on how we strengthen support for our communities around Arizona. And the timing was perfect to leverage this Data Champion project to do so. And we wanted to use the data specifically at our Be Connected Communities Academy, which we held in February, and with our risk reduction framework, which really focuses on how do we strengthen our upstream prevention work with our military and veteran population. Next slide. So I'll talk a little bit about that risk reduction framework and then how our Data Champion partnership fed into the next slide. Our focus with the risk reduction framework is really understanding how you approach an issue like suicide, where your real key outcome, which is reduction in suicide, reduction in the disparity in rates, is a long-term measure, multiple years to see that decrease. So we wanted to understand, how do we understand if what we're doing today is moving us closer to that goal, even if we might not see the effect for many years. So our approach is to focus on proactively decreasing the suicide risk for individual veterans and segments of the veteran population. And the goal is that then over time, that will result in the decrease of the suicide rate across the entire population. Next slide. So in order to do that, we worked with the CDC to develop what we call our intermediate outcomes. And these would be things that would be indicators to us that we are achieving that reduction in individual and segment suicide risk. So these 4 areas are ones that we focus on. Again, a lot of overlap with the Measuring Communities platform. So increase access to care, increase access to support, improve social determinants of health, and increase social connectedness. These are things that tells us have a big influence on people's suicide risk. Next slide. So how do we put the risk reduction framework into action? On the next slide, it shows the 5 steps that we are working with our Be Connected communities. And you see that it's gather, learn, design, do, and grow. And the data really comes into play specifically, very importantly, in the learn section, which is making sure that we have that that data available and that we can tap into that to help guide our efforts, both on the statewide level, but on the community level as well. So on the next slide, you can see we brought our communities from around Arizona together in Phoenix in February of this year, had a fantastic group, really dedicated individuals, eager to learn, eager to work together to generate solutions and move forward. And on the next slide, you can see the different participating communities. It was fantastic. We had communities from our more urban areas, from our rural areas, and some of our tribal partners also had community teams represented. So we had a really nice kind of snapshot of that represented our Arizona veteran population. Next slide. So the focus of our risk reduction projects when we're working with our Be Connected communities are first and foremost to be data informed. So to, again, use that information to help understand what the needs are and also help develop solutions. And then very importantly, of course, to keep them very human centered. We in the end are people helping people, right? So understanding what those needs might be and taking this very human centered approach to developing solutions. And our goal is always to be as upstream as possible as we can when we're doing this work. Crisis intervention is absolutely essential, and it must be there. But we want to go upstream when we can to address those needs as early as we can and prevent issues from happening. Next slide. So we were selected to be data champions, and the team at MFRI and the Measuring Communities team were very helpful in creating both statewide, tribal, but also county by county data profiles. We only have 15 counties in Arizona, so that made it a little bit easier. And again, that sort of granular level data was really of interest to our community teams. They are hungry for it, and they are very eager to use that. So you can see on the next slide. This is our teams when we really started the process with sharing this data, other information. So we turned all that data into county profiles and statewide tribal veteran profiles. And that really started, discussion, inquiry, and really gave everyone the opportunity to have something to focus on to start. So instead of a blank piece of paper, they had information that they could tap into. But we really see the data profile as a starting point, not necessarily an end point. And so one of the things that we worked with our teams on and will continue to work with them on is on the next slide, which is sometimes the data tells you things you need to know, and sometimes it tells you things that you don't know but would be helpful, right? So we also work with them on what other kind of approaches can we take and work with them on to gather other information that would be helpful to develop these risk reduction strategies. So we had a tremendous response. Everyone was very appreciative of the information that was shared by the Measuring Communities team, and so glad to be a part of this. So next slide. We just want to thank MFRI and the Measuring Communities team for working with us, supporting us with this, and for providing such an excellent platform for everyone to use. Thank you so much.
Thank you very much, Nicola. Next, I would like to introduce Andrea Allard. She currently serves as the Outreach and Transition Support Director for the North Carolina Department of Military and Veteran Affairs. Her work with veterans focuses on the transitions of life, empowering minority and women veterans in benefits attainment, accessing housing for homeless veterans, and advocating for greater availability of mental health resources in the prevention of suicide. Andrea is a U.S. Army veteran who comes from a military family. Welcome, Andrea.
Hey, thank you so much. I'm glad to be here today. This is exciting. And let me tell you a little bit about who we are. Next slide, please. We are the North Carolina Department of Military and Veteran Affairs. We are a cabinet level agency, and we're broken into 3 groups: military affairs, transition, and veteran affairs. Next slide, please. Our mission is, you can see, is to support the military community in North Carolina, including their personnel, our installations in adjacent communities, and support our state's veterans and their families. We provide access to a full spectrum of resources that further enhance North Carolina's military and veteran-friendly environment. Next, please. I applied for this data champion opportunity. I got an email and I thought this was so excited. I had been using MFRI's research in many of the programs and ideas that I've had. And so when I saw that app, I thought I got to immediately apply for that. So I did. I applied for it, and because we need data. In our state right now, we have no dedicated women veteran coordinator, and therefore we have no dedicated women veteran programs. And so this very targeted study on a profile of women veterans in the state of North Carolina is something we really needed to drive this forward. And as you can see, we do have a large proponent of women veterans in our state, more than the national average. And we're also ranked 6th among all the U.S. states and territories as well in number of women veterans. And that's what makes this so important to us. And you can, next slide, please. Now, our study, we broke it into the regions of our VA medical centers because we believe in strongly partnering with our federal agency, the federal VA. We have a great relationship and we work with them on many, many things such as homelessness, food collection, and benefits as well. Next slide, please. So as you can see, with our large number of women veterans that we have above the national average, it's important that we study this. And if you notice, most of them live right around military installations. Those dark ones right there in the center around Fort Bragg, Cumberland County, around there. And then down on the coast is Onslow County, where we have Camp Lejeune, Cherry Point, and the mostly clustered. Next slide, please. Our women veterans than men veterans, which is a lot of what like Katie shared with you as well. And we're very proud of that here in our state, of having such a wonderfully diverse group, providing unique opportunities for our women. Also, if you notice, like I said, the majority of ours are centered in the state with 52%, 52%, and 51% right in the middle there. Those are right around the center of in the middle of our state where you see that. And 38% of our women veterans are between the age of 35 and 54. That's a very important number to know for us in program creation. Next slide, please. 51% of our women veterans are married, with 21% have children at home. That is close to the national average. It makes me think about, while I was in, the fact that I waited till I was older to have children in order as due to my service connection. So that made sense to me. Also, next slide. Now, both these groups, the 18 to 64 women veterans and the 65 plus, if you notice on the data there, they both have higher rates and percentages of being in below the poverty line. That is a critical piece of information for us to understand. We don't know. We need to figure that out. Why is that like that? And of course, as a transition person, it makes me think it's during critical transition periods in their lives that are leading specifically to these higher percentages. Next slide, please. Now, if you notice, it's very interesting about SNAP benefit usage in our state, that around our Durham VA Medical Center, we have both the highest usage and the lowest usage. That tells you about the tremendous difference socioeconomically just in the little small area around our Durham VA Medical Center. So I found that extremely fascinating to know that. All right, next slide, please. This slide tells you that Mecklenburg County, which is where Charlotte is, and Wake County, which is where Raleigh is, have the most mental health resources. Kind of makes sense. Big cities, they're right around there. But also notice over 20 of our counties have no mental health services. That is 1/5 of our 100 counties have no mental health, and we are a very rural state, so this is critical for us to know. Next slide, please. Here you see that we have a lot of women with service-connected disability ratings and a very high amount of women, 60% of that over 70 and above. So you can go to the next slide, please. Now I want to share with you why this is so important. What we want to do with this data, we want to make sure we develop targeted outreach to specific areas by need and partner with that VA medical center or the community-based outpatient centers as well in those areas. Target where the needs are specifically. We want to ensure our women veterans get connected to the VA the healthcare and mental health care resources, as only about 40% of women veterans in our state are even connected. So that is a suicide prevention and awareness thing. Also, during transition period, we need to provide financial counseling during these. We need to provide tools for that for our women and make sure they have access to state food programs as well, as they know locally where resources are that they have if they have needs such as food, clothing. Next slide, please. Through our rural transformation healthcare program that we have in North Carolina, we want to make sure that military cultural competency training is made mandatory. I think this is essential in our state as we have so many veterans and women veterans. We want to develop also student veteran groups. That is critical, as many of our women veterans in North Carolina, over 90%, have at least some college. Great place for us to find them and develop those groups. And we want to advocate for more gender-specific care. We need that. So, so important. And the last thing I want to say is thank you, Katie. Thank you so much for this powerful data. It's going to help our agency develop legislation to improve the overall financial, physical, and mental health well-being of our amazing women veterans in North Carolina. Katie, you are a jewel. Thank you.
Thank you very much, Andrea. After hearing from our data champions, you're probably wondering how you can get a custom data profile like Nicola and Andrea just presented on for your organization. Applications are now open for our next round of data champions. This program is free and open to anyone who works with the military-connected population. You can learn more by scanning the QR code on the slide or following the link. Many of you may have also gotten an email from us this week about another program called the Evaluation Champions Program. This is a separate initiative that gives nonprofit organizations and researchers the unique opportunity to work together. Lots of really great stuff coming up. If you have any questions about either of these programs, feel free to reach out to us. We're excited to officially open the application windows. Lastly, please also remember that you have free access to military-connected data at your fingertips through our Measuring Communities online data portal. To access the portal, navigate to www.measuringcommunities.org, click the first button on the pop-up window, Explore Web-Based Data, enter your member ID. Member IDs are specific to organizations and agencies and coalitions. If you don't have a member ID, you can use the one on this slide here, which is Report 26 with a capital R. Then you'll want to enter your name and your work email address and click Submit.
Now, the moment you've been waiting for. The full Spotlight report is now available to view. Please use the QR code on this slide or check your email later this evening for a link to the report. There will also be a replay of today's event available on the MFRI website. We are grateful for the generosity of our partner organizations, several of which are represented in our audience today, who share their data through Measuring Communities. Thanks as well to the funders and partners who have made Measuring Communities possible. I especially want to express our thanks to the Purdue Center for Regional Development, which has given its technical expertise and guidance at the very earliest design phase. And I also want to acknowledge the financial support provided by Lilly Endowment. That concludes today's event. Thank you to all of our speakers who shared their insights and how they're using data to support their work with the military-connected population. Special thanks as well to members of the Measuring Communities Advisory Committee and the MFRI Advisory Council for their input and guidance. I also want to recognize the MFRI staff. Katie, of course, is amazing, but Katie is supported by a large group of colleagues who also work very hard and whom I'm very grateful to be able to work with. And thank you all for attending. So appreciate your enthusiasm for our research and your commitment to support our military and veteran families in your communities. Have a great day.